Thank you very much for the invitation to address. It's very frightening looking at a monitor with yourself on it. Thank you very much for the invitation to address you this morning. I was very reassured that in the debate over the last hour or so, if anyone spoke out of turn, the chairman was quick to reassure them that they hadn't said anything inappropriate. I'm probably going to be the first person who will say something inappropriate, so I beg your indulgence. I didn't come to talk about paying conditions. I listened with great interest to the discussion that has taken place in the last hour, and I understand only too well the dilemma that an awful lot of people face as a result of what are essentially political choices that have been made, not just in the recent past, but over the last decade or so. I come from an organisation, Bernardo's, where there are 350 of us. And those 350 people have voluntarily agreed to take pay cuts ranging from 6% to 16%. And they've done that, it hasn't been forced on them, they've done that for one reason and one reason only, because as tough as things are for those of us who work in the organisation, they're an awful lot tougher for the people we work with. And they've done that, they've taken what is effectively 500,000 out of our payroll by voluntary action in order to try to keep all of the services that we provide to children and families going. As tough, as I say, as things are for people at work, they are going to be even tougher for the people that we work with, that you work with and that we work with. And I suppose it's those people, in a sense, that I'd like to talk about. Last year, we did a fairly detailed study of the people that we work with, the families that we work with in Limerick. And one conclusion leapt off the page at us to such an extent that it's forced us to re-examine everything we do. And that conclusion was that there is an unmistakable connection between the well-being of mothers, particularly, and the well-being of children. And the factor, apart from poverty, and poverty is something I could talk about for a long time, the factor that affects the well-being of mothers in many thousands of homes around Ireland, more than any other, is the mental health factor. And the intergenerational consequences of mental health challenges faced by parents under stress, and particularly by mothers under stress, as a result of a whole range of additional factors, is huge. Last November, we hosted a conference in Dublin to mark the publication of a piece of research that we had commissioned, which we called Tomorrow's Child. The idea behind the research was to highlight some of the challenges facing children and young people in the rapidly changing environment that we all live in now. One of the speakers we invited to come over was a fascinating man called Steve Ose. He's one of the world's leading authorities on how to get value for money from social care programs. Although his primary responsibility is to advise the Washington state legislature, he has over many years found the answer to one pressing question for state governments all over the US and around the world. And the question is this: how can we do it better and still get value for money? The answer to that question has led to prison building programs being scaled down or stopped. It has encouraged governments to invest in early education. It's led to major investment in health programs, and particularly in mental health. And these things have happened because he can demonstrate that the investment in alternatives will produce a better rate of return year after year for taxpayers' money. I don't have time here to go into the process that he undertakes, but I will say, and it's well established, that it's neutral, non-partisan, rigorous, demanding, and internationally respected. And he himself would say that there are 3 good ways to do things better and to get real and lasting value for money. They are prevention, prevention, and prevention. And here in Ireland, there are a couple of examples of people or organisations like Steve Ose. One of them, for instance, is called HIQA, the Health Information and Quality Authority, in the news today in respect of Waterford Hospital. HIQA has set out to try and answer exactly the same question: how do we do it better and get value for money? They use a process called a health technology assessment, designed to answer the question through rigorous research. All of their techniques would be similar to those used by Ose and his team abroad. HIQA has produced only one health technology assessment so far. It was designed to answer an important question: If Ireland set out to produce a vaccination to every girl in the country against the virus that causes cervical cancer, would it work and would it be value for money? We know the answers. They compared the cost and benefit of vaccination and screening against the cost and benefit of screening alone. The vaccination is against the virus HPV, which causes 70% of all cervical cancers. In 2004, 90 Irish women died of cervical cancer. On the law of averages, that means that about 60 Irish women were killed by the HPV virus. Vaccination wasn't available when those women were children. It works best when administered to girls between the ages of 10 and 12, but it is available now. And reputable bodies all around the world recommended years ago that it should be routinely given to girls. It involves three injections. So it's hardly surprising that HIQA found itself in a position to recommend to the Minister for Health that we should, as a matter of public policy, institute a programme of vaccination, and that we should seek to get to the point as quickly as possible where 80% of girls of the relevant age would be vaccinated. They found that not only would the vaccine be effective in preventing death and suffering, but the combination of vaccination and screening would produce a substantial value for money return to the taxpayer. And the cost of all this would be, according to HIQA's estimate, about $9 million a year. $9 million a year would save 60 lives a year, and it's roughly the cost of building 1 mile of motorway. It's an investment in prevention that is backed by all the reputable science, and the taxpayer is ultimately the winner. Which is why I think anyone who heard the Minister say that she'd rather spend the admittedly scarce resources available to her on screening alone must have felt a deep pang of despair. It's hard to imagine a more short-sighted, more blinkered approach. If this is really how public policy is to be built, if people are going to be forever sacrificed to a form of stubbornness that is willing to ignore all professional advice, one could begin to question the value of independent research of that kind. However, it's not the only example of what you might call cost-benefit analysis going on. Last September, the Irish Mental Health Commission published a 132-page report called The Economics of Mental Health Care in Ireland. It was written by Eamon O'Shea and Brendan Kennelly. In their introduction to the report, the authors say that, of course, the reason to invest in mental health services, indeed in health services in general, are much more than economic. A society's decision on the extent to which it will provide services and support to its most vulnerable people, including those with health difficulties, springs from its social and moral values rather than from rigorous cost-benefit analysis. This report does not say that mental health services should be provided only because this is economically advantageous. There are much more fundamental reasons behind society's decisions on how it should allocate its resources. However, the report does show that aside from the moral and social arguments, there is a powerful economic case for investment in mental health services. And it goes on to make that case in considerable detail. I hope you'll forgive me if I quote a few paragraphs. It says the proportion of total healthcare expenditure devoted to mental health care in Ireland at just over 6% is very low relative to other countries. The reasons that policymakers should invest more in mental health are: 1, the economic cost of poor mental health in Ireland is very significant. 2, the Irish public has expressed a willingness to pay extra taxation for a mental health programme that would enable more people to live in the community. And 3, there's a burgeoning economic base of evidence